More than 1 million people a year attend the emergency room with a severe ankle sprain. Hundreds of millions more will have sprained their ankles but never sought help. It affects celebrities, athletes, and to be honest, most of us will have rolled our ankles at least once. Hi, my name's Andy Goldberg. I'm a medical doctor, an orthopaedic surgeon, and a father to 3 young kids. And just like you, scared around this whole COVID pandemic. So if you sprain your ankle right now, I want to save you from hours queuing in an emergency room, which is the last place you want to be, and give you some top tips of things that you can do right here, right now. So we're going to cover what is an ankle sprain. We'll go into the biology a bit. What should I do if I sprain my ankle? Things that you can do at home and when you should seek expert help. And things you may want to avoid, like this unconventional take on how to fix a sprained ankle from a video from India. I certainly wouldn't recommend this as a treatment. Finally, we're going to meet some of the UK's leading expert physiotherapists to show some exercises that you can do at home to get you back to full fitness. So let's start with a bit of basic science. What happens when you roll your ankle? So the ankle is stabilized by strong ligaments, and these hold the bones together. And if you think of the ligaments a bit like an elastic band, when you stretch an elastic band, it goes back to its normal shape. But if you overstretch it, sometimes it stops acting like an elastic band, or it can even rip apart. And that is what is an ankle sprain. We tend to grade these as grade 1, where they're stretched a little bit, a few fibers tear, grade 2, where you tear a lot more of the fibers, and grade 3, where they tear in half, like a torn elastic band. A grade 3 injury is often very swollen and bruised like this, and is the most serious. So what should I do immediately? Well, there's a paramedical term known as RICE. R is for rest. Why? Well, just like any action hero, in this case Charlize Theron in Atomic Blonde, once you've been injured, the body's knackered and needs time to heal, and you need to rest. Which brings us nicely to I for ice. Ice helps dampen down some of the inflammatory response. There's a lot of controversy on the internet about whether to use ice or heat. In fact, some people actually say that ice is bad for you. Is that fake news? Why don't we just clear this thing up and bring in our experts? Chris, hot or cold?
Definitely cold. Cold, 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 not hot.
You've always got to use cold when something's sore. It helps to relieve the pain, and it always seems to make a good difference.
Most of the evidence suggests that in the acute phase, which is in the first few days, the first sort of 48 to 72 hours, that cold is the best thing to use, because that's what helps control the pain, the inflammatory exudate, and prevents the joint from becoming swollen and controls it. And that's why you see most footballers, as soon as they have an injury, get off the pitch, put some cold on their ankle.
C is for compression, such as using a compression bandage like an ACE bandage to help keep the swelling down. In this case, it's done by a professional, but if you're at home, you just take a bandage and apply it, really to stop it from swelling. Then comes E for elevation. Why? Because gravity's not on your side. Fluid and swelling tend to pool in your feet, and the only way to reduce that is to elevate it to your heart level. Let me bring Harine in here. So we've done the icing. Do we need really the compression and elevation?
You need to elevate it along with cold, okay? If you're using cold pack, if you're using anything, you need to have it up there. You need to have it slightly higher. Elevating it is more important.
Okay, so everything we've spoken about is emergency treatment that you can do at home. But if you're worried or concerned, Matt, can you tell us what would make you go to the emergency room?
So you've rolled your ankle. If it pops, if it swells immediately and it's really painful, I think you need to go to hospital. It's time for an x-ray.
That's great, Matt, but even if they go to A&E and have an x-ray and shows it's not broken, without an MRI scan, sometimes it's really hard to rule out a grade 3 ankle sprain, which in my opinion is often worse or more serious than a simple crack of the bone. So how can someone watching this video know if they've got a grade 3 injury? Well, it's difficult even for an expert. So my advice is that if it looks like this with bad bruising, it's swollen and it's painful to weight bear, then I would treat it like a grade 3 injury and I'd recommend you wear an ankle brace. Sometimes when it's a severe injury, we use a walker boot and maybe even give them crutches to protect the ankle and allow things to settle down. Matt, can I bring you in here? Are braces any good?
Braces are fantastic. When you sprain your ankle has too much movement. So you want to limit the amount of movement you've got. Stick in a brace, control the movement, it'll help you get much better, much quicker.
So what we're trying to achieve is that the two ends of the ligament heal in a normal anatomical position. If you continue to use it or stretch it as it's trying to heal, then the two ends may heal stretched or long. A good ankle brace doesn't limit up and down motion of the ankle. It just limits side to side motion. That's the inappropriate side to side motion that stretches the torn ligaments. So it's that motion you're trying to stop. And that's what a good ankle brace that has a strut on either side will do. It will support and stop that motion. So I recommend that for a grade 1 or 2 ankle sprain, you consider a brace for a few days, maybe even longer for a couple of weeks. But for a grade 3 ankle sprain, I recommend that you consider it for 4, sometimes even 6 weeks. Not everyone has access to an ankle brace, so you can, of course, make it DIY. This guy's got an interesting take on it, using cereal packet and a bit of cardboard and sticky back plastic. And there's nothing wrong with that. Contrary to popular myth, ankle braces don't make your ankles weaker. If they did, then Andy Murray wouldn't wear them for almost every game he plays. His function is amazing, even with the ankle brace on both ankles. Now we want to move on to some exercise. Now, the time you can do that clearly depends on how quickly the swelling comes down and the ligaments start to heal. At that point, let's say it's a stage 1 or 2 injury. Harine, what next?
In the first 24 hours, rest, 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 gentle ankle movements. Then gentle activity, weight bearing, and slowly keep increasing activity as time goes on.
But also the optimal loading, the way how you must take weight on your ankle, because that's what it's designed to do. And the longer you stay off it, the sore it becomes. So why not do some very, very, very simple, just some weight transfers, where you're going side to side, but you're taking weight. I'm saying this is going to be my left ankle to sprain. I'm going side to side. I'm going backwards and forwards, but I'm really pushing down on my foot.
Once the swelling's reduced, so probably after a few days, it's really important to start moving the ankle. So the first exercise, you just have to imagine writing the alphabet with your toes. So we're going to start at A and go all the way through. If it gets a bit sore, then you just break it down into different parts. And we'd advise that you did this every couple of hours. So let's start. So we do A, B, C. I think you get the idea. But what it's great for is starting to get some movement through the ankle joint.
So here's another exercise for you. Once you've done all your alphabets, you can do them forwards, backwards. You're going to pick up something like a dressing gown robe or a resistance band, or you can even use a tie if you need to. You're going to place it around your foot. You've got to think about working those muscles on the back of your calf, and you're really going to push out nice and strong and come back in. We're working all those muscles on the back of the calf, so you might want to do both sides, otherwise you might end up walking around in circles.
Sam, how many repetitions?
So in terms of repetitions, movement is something to do regularly. So every hour I would be doing or advising patients to do 10 or 15 each of those exercises. Again, as long as it's comfortable and not too painful to do, then movement is the key.
Matt, we started with rice and then we added an ankle brace and some loading. To avoid any confusion, can you please summarise?
Well, we now talk about the police recipe, which is you protect it, your ankle brace, you optimally load it, so make sure you are taking weight in it. You then go to ice, compress and elevate it. If you're icing, remember it's frozen peas, 20 minutes on every couple of hours, but make sure you protect your skin. So you put either a damp tea towel, you put some oil on it, okay? And then you compress it, you can bandage it up and elevate it, get it up. Your calf muscle becomes tight because it becomes protective, but don't stretch it. Don't stretch your calf muscle, because what that's going to do, that's going to increase the ankle range, and you've got a sprained ankle, you've got too much. Instead, why not use a rolling pin, a bottle of wine, anything to try and improve the flexibility of your calf. A bit like this. Rolling pin, bottle of wine, and roll your calf. Get into all the tight knobbly bits, the bits which are sore and uncomfortable, and roll it around. Or use your hands. You can touch your calf, it's okay. Because all of that stuff really helps the flexibility. Because what you're doing today is to make sure you can get out there and get running tomorrow much quicker.
What an amazing masterclass. Thank you so much to our experts for all that really helpful advice and guidance on what to do for an acute ankle sprain. Remember, this video is about the acute ankle sprain, which brings us nicely to our next video, which is what happens 4 to 5 weeks later once the swelling's come down and you want to start strengthening the ankle and getting it back to peak performance. I hope you found this really helpful, and we'd love to hear your comments and suggestions for new videos. And don't forget, like and subscribe.